Well, good morning. I have 10 o'clock on the nose, so we will go ahead and get started. Um, we may have some additional people joining here as well. But for those of you who don't know me, my name's Kirsten, and I'm the CEO for Leading Age Nebraska. There were some folks on the list for this call that I didn't recognize their names. So if we have not met, I would love to meet you at some point in the future. Thank you all for coming today. Leading Age Nebraska wanted to get together with our members to talk about some resources that are available to support you with your CMS proposed staffing rule comments. As you know, I'm not going to go over the contents of the proposed rule. But as you know, CMS has proposed this rule for minimum staffing requirements, as well as some other changes to nursing facilities. And we want to be able to support our members in making those comments on behalf of themselves, but also the support to get other people involved in that commenting process. So we appreciate you logging in to do that today. So on our agenda, I would love to hear some feedback from our members on how you are involving your team. What are you doing right now to support other people to understand how to make those comments and see what you're already doing, what's already in place at your communities. I know a lot of people have been working on this already. And then for those that need support, we'll talk about how do you make comments, and we'll also talk about who should be making comments, and then offer you some examples of how you can get those comments submitted on behalf of yourself as well as other members. So I guess we'll just start with who have you already involved at your community to make comments. I'd love for you to share with us what you're already doing. Anyone have anything that they're already doing at their communities?
Hi, good morning. I've sent it out to our board members and asked our management team to also provide feedback and comment. So I haven't heard who's also submitted anything yet, though.
Okay. That's great. Board members are good. We want to get them involved. Anyone else? Are you planning to submit comments on behalf of your facility? Is that in the works with everyone?
This is Miranda.
Miranda, was that you?
Yeah.
Hi. I think we're having trouble hearing you. It's a bit better, yeah.
I don't know what's going on.
Oh, there you're good. You're good.
Okay. I put a letter in all of the residents' building this past month for their families. And I've had several family members call me and they're submitting comments and letters.
That's great. That's
And
great.
I also called their local doctors and hospitals, and they're submitting comments also.
Wonderful. That's good to hear. Stacy posted and said, we posted the link to submit comments in our intranet. I provided the information to our board, and I have a letter to the editor coming out in this week's newspaper for the public. That's great. Dee Dee said that they asked management team to provide comments. That's wonderful. Anyone else want to share? right. Well, I appreciate those that are already working on this. I can't stress enough how important it is that we do get comments submitted for this. To kind of give people a little bit of a perspective, all of us remember when we had the rule for nursing facilities to do vaccinations for their employees. In that comment period, we had over 10,000 comments that were submitted, and most of them were in support of not singling out nursing facilities for that purpose. What we're seeing right now, there's about 6,000 comments submitted for this, and there are a lot of comments saying, yes, this needs to move forward. So we really need to make sure that our voices are being heard and that we have information out there that's going to support what we know as the facts. And the facts are that this is an unfunded mandate. We financially cannot afford to provide this level of staffing, and that there simply is not enough of a workforce for us to be able to comply with this. So we want to make sure that those voices are being heard as we move through this. So we have a couple pieces of information here. If you're not sure how to make comments, or if you need support in that, we do have a link to access the rule in the Federal Register listed here, and I will send this out to the membership following this meeting so that you can use the links that are in here. You can also use this QR code that we've put on the screen. So if you just want to scan that, get it on your phone, you're able to email it to yourself, download it, send it to your staff, whatever you need to do. QR codes are always an easy way to communicate with folks. We do know that comments need to be submitted by the 6th at the end of business that day. And they do need to reference the file code, and that is CMS 3442P in your comments so that they know that that's what it's for. Those written comments that are being submitted, if you're going to actually write into CMS to provide those comments, they need to be received by November, I said 5th, but it's actually November 6th. So if you are planning on doing it in a written format, not in electronic or email format, make sure that you're getting that done very, very soon so that we can assure that it arrives to them in the mail by that time. Another piece of this, in what the scan or the code actually goes to here, is our action alert. So Leading Age has put out an action alert for members to be able to use. And what it is it's like already pre-selected to go to the Federal Register. And it does provide a little bit of guidance on making those comments. So we do want to make sure that if people need support on doing that, that they have a method for doing it. And then we will also talk about who should comment and how we communicate to them what we want them to talk about. So I'll move on to who should comment. As Oprah would say, everyone needs to comment. So we really want to hear directly from those facilities who can provide information more specifically on how this rule would impact them at their local level. We also want to hear from staff, especially LPNs. So if you've read through the rule, you know that LPNs have been left out of this rule entirely. And in Nebraska, as well as other states, we rely heavily on these LPNs. And so we want to make sure that their voices are being heard and that they know and understand what this could impact in the future. I've talked to a lot of facilities that will tell me about, the number of LPNs that they use. And I think what we need to remember is that if we have to meet these staffing ratios through CNAs and RNs, there's only so much money in the budget, and that means that we're going to have to reduce the number of LPNs that we have in order to increase staff in other areas. Obviously, we don't want to do that. We value our LPNs and we know what they do. We need to make sure that CMS knows that as well. So they're providing quality services here in Nebraska. We also need to talk to our CNAs and our RNs about providing comment. There's simply not enough of them to go around, and we need to make sure that they know that we need them on our side and what those financial implications might be for facilities that need to hire more of those folks. Some of you already talked about your board members. They're the ones that are approving your budget, and they know what your financial position is to be able to meet this. So you'll need to provide them with that education and the knowledge about what they need to do. But getting them on board is very good. Other folks have mentioned family members and residents, those kinds of things, hospitals, I heard. So that's great. Anyone and everyone, and the more comments, the better. So we just really need to spread the word to get that out. I have a whole lot of words on these pages, and that's why I will send these out. And what I've actually taken this from is a couple documents that I have linked for you at the end. So that may be an easier way for you to access this information. But I get a lot of what should I talk about? And what we want you to talk about is what the impact is to your community. We want to know what this is going to mean for you now and in the future. I've heard from a lot of our members that they are currently exploring financially, what would this mean? How much is it going to cost them? We do have that information available from Leading Age, and we've sent it out to members. If you need to access it, well, there's a link at the end that will give you that information. But it's not just the financial piece, it's about what will happen. I've talked to a variety of our membership, and I have heard everything is pretty much on the table. So it's everything from, we're going to look at reducing our census to the number of people that we would be able to serve with the staff that we have. The average going rate for that is a reduction of 25%. I've had people say that they're going to close down a wing. I've had people say that they're considering closing entirely. I've also had members say that they may take beds or facilities offline with CMS, with Medicaid and Medicare, that they would move to private pay only or other insurance only. So they just wouldn't accept those payments. And overall, what any of those options mean is that it's going to be devastating for people in Nebraska that need these services. So we really want to know what that looks like from your perspective. What are you thinking about? Now, remember, this is a 5-year plan for rural and a 3-year plan for state or for urban areas. And that may, let them know what your timeline is. If you're looking at making changes before that date, because of other things that are going to be implemented prior to that, because there are pieces of the rule, including the 24/7 nursing, that would be implemented before that. So we do want to make sure that they have all that information. From the community perspective, one of the talking points is going to be that funding goes hand in hand with quality care. We can't provide the services that we need, that they're saying we need to provide, if we don't have funding. We're already not meeting the financial needs of our organizations, and we need to make sure that those finances are there for us to increase staffing. Another talking point is, I don't want there to be any confusion that we don't want quality care. We feel that we're already providing quality care. Leading Age members are heads and tails above most of the communities that are providing services. And we need to showcase that. We need to tell them what we're doing and why it equals quality. So you can equate that to your 5-star review. You can equate that to your lack of abuse or neglect. You can equate it to your surveys of your membership or of your residents and their families and how they feel about your services. Pick whatever metric you want, but what we really want to stress is that we do believe in high quality care, and that's the goal for everyone. Another group we want to talk about is families, and this would also include residents. We do want to make sure that we're getting their perspective, and we'll talk about a little bit later how do we make sure that they're understanding what we want them to comment on. But one of the talking points is, and what I hear families and residents talk about is they want to make sure that they're going to have access to that quality care, and that they're going to be able to receive care. If we continue to reduce census, they may not be able to receive that care that they want. So we want to make sure that they're commenting on that. And then I think most of them know that there is a workforce crisis in healthcare as well as everywhere else. So we want to make sure that they're commenting on how that workforce and the cost of workforce is impacting our ability to hire and retain staff. We have really 3 different areas for nursing. So the first one that I'm going to start with is our LPNs. And we want to make sure that our LPNs are able to provide comment, share their experience on what is going to impact them and why the service that they're providing is important to residents and families. Folks need to hear from them directly, and we want to be able to share that message. And I also have heard a lot of people talk about, well, why don't these LPNs just become RNs? And there's a variety of reasons that they don't. For some of them, it's access to a nursing program. Nursing programs have waiting lists and they're full. Maybe it doesn't work with their home life or their schedule. Maybe they simply don't have a desire. They love their job and this is where they want to stay, and they don't want to get into more debt because they're currently able to do this job. For others, it's lack of funding for school. So those are all comments that we would love to hear from LPNs on why they are not doing that. Talking points from this perspective, CMS's research that is proposed on the proposed rule ignores the essential contributions of those LPNs. So we definitely want to make sure that we're talking about that. We also want to talk about the basis for this decision. It was never really explained very well in the proposed rule, and we want to talk about the contributions that they are making. As for RNs, there's a huge emphasis on RNs in this rule, and especially for our rural communities, but even in urban areas in Nebraska, the ability to access RNs 24 hours a day, 7 days a week is very unrealistic. And we still do have staff that are providing care around the clock, but those minimums of the proposed rule nationally would mean that we need over 3,000 additional RNs to do that. And to meet that 24/7, it would mean that we would need over 12,000 of them. And they simply don't exist. We've talked to senators and congressmen about this in terms of, it takes 4 years just to educate and grow an RN. Many of these communities have wait lists. Many of these people can't attend full time. So we're talking, 6 years to grow another nurse. And we simply don't have that kind of time, and it's not producing. We don't have enough programs in Nebraska to get this amount of staffing in place. And then, you know, we want to make sure that there's the right mix of good leadership. The other, you know, LPNs isn't the only thing that this rule ignores. And I've heard from a lot of you on this. You have department heads, you have nurses that are doing your MDS, you have nurses that are on call for you, you have medication aides, you have dining staff, you have a variety of people that are filling the needs, and we need to paint the picture that we are an entire community. We're not just nurses, we are all together in this for the greater good. So we want to share those stories about how you are meeting those things now, and maybe the other pieces of the rule that they are not including in there. As we all know, CNAs are also a big part of the rule. And I think the big thing that we want to point out from the CNA perspective is that not all nursing homes are the same. CNAs can do a lot of things in our programs, and they are very dedicated to providing bedside care. And the facilities, among leading age at least, think about their staffing levels and who they have before they accept people into their program. And they do it based on the ability to care for those individuals. And they make sure that they're putting in place those that they feel that they can care for. So what we really want to point out is that we are providing care based on the level of need of the people that we support. And then again, we want to talk about the workforce crisis that we have going on and how it's going to be very difficult to be able to meet this rule now and in the future. For our board members, you know, we really want them to share their role in the community, share their role of why they're serving on the board, and what they feel the impacts are going to be on that facility that they are supporting. A lot of these that have boards are, you know, mission-driven, nonprofit organizations that have worked through the pandemic, and now they're working through this, and they're trying to figure out that path forward. We need to give CMS a realistic picture of what this looks like for these communities. Sharing what will happen in the future if this rule is enacted, sharing their concerns and the need for workforce. As most of you know, CMS put a few $1 million into workforce recruitment because of this proposed rule. And it is a minuscule amount of money compared to what it's actually going to cost us to recruit and train enough staff to be able to meet the needs of this rule. So we really want to talk about, again, that equitable access to care, and that there's a real human impact here. If we don't get this right, those that are receiving support or need support from nursing homes are the ones that are actually going to suffer here. We want to be able to provide services now and into the future. Any questions on that before we kind of move on? All right. So I have gotten some questions about sample letters. And this is information that I've actually taken directly from Leading Age. So at the end, I'll have links to all of it, but it is available for members only, and we'll have it there for you. Leading Age has produced some sample letters that are both from you explaining to different groups how they need to report and what they need to comment on. And then they've also provided that group a sample letter based on what that comment should include. And a lot of it is those talking points that I just went through. So all of this is kind of connected, if that makes sense. So this one is for board members, and what we really want them to focus on is making sure that CMS understands that there will likely be a decrease in the access to care, that we will have longer shifts for those RNs. So they could be working 8 or 12 hours now, but we may now need them to work 16 hours instead, because we need them there 24/7. And explain what that looks like for your community. I know I've talked to a couple that their director of nursing, they're on call all the time at all of these facilities. And that director of nursing literally lives a block away from the nursing home. So if someone calls, they can literally show up within minutes. But the rule actually says that they have to be on site and available. And that's a huge change for us, going from 8 hours to 24 hours of having that. So we talked about longer shifts, less money for other types of staff, and that the rule itself is going to not only require this level of staffing, but someone to make sure that the staffing is happening the way that it's supposed to. I've talked to so many of you that talk about it's just another nurse sitting behind a desk, doing paperwork. And where we really need them is providing care to folks that we're supporting, and this is just going in the opposite direction. So when this is the information that we can give to our board members so that they know how to make their comments. And then the sample letters also include more step-by-step instructions and some sample language to support them in making sure that they are providing those comments and that they feel comfortable in doing that. We all know that if you could, copy and paste something and send it to them and say, here, send this out. But what we're really looking for is unique comments. So while they can all focus around the same ideas, we need to make sure that we are focused on getting unique comments in from each person, really expressing their own thoughts, feelings, and beliefs about how this is going to impact their community. The next piece is from the nursing homes themselves. If you need to spread the word amongst your staff on how to make comments, this is a good template to be able to follow, to get that information out there to them. And then again, there's a step-by-step instruction on how to do that and some sample language on how to get that information out there. You'll see that a lot of these on the insert your own story and use the comment topics or talking points. Those are all linked back in the previous slides, and then they'll also be at the end in that document that you'll be able to download. Sample letters from residents and families. I've had a lot of people ask, how do I begin the conversation with residents and families? How do I get them this information? And this is kind of our template for that. And what we want to explain to them is, how did this come about? That it was a CMS proposed minimum staffing rule. And we want them to understand what the impact is going to be on the organization. And that we simply don't have the staff to be able to provide the services because we don't have the funding and we don't have the workforce to be able to do that. Explain to them why it's important for them to get involved in the comment process. Make sure that you put phone numbers on there. I know that they will probably reach out because this could be very concerning to families and residents. We've heard of folks doing this at their resident council meetings. If you have family councils, getting the information out, not in written form, but in verbal communication first, and then offering them support and guidance for making those comments is going to be key to doing that. We also have kind of a step-by-step example for them, so that we're supporting them to get those comments out in the easiest way possible. And I don't know if you've ever looked for the Federal Register, but it can be a little difficult to find. And that's why we created that action alert, because it will link everything right to the Federal Register. And it's just a little bit easier way. You can get the same link to everybody. They can put in all of their information from there and submit their comments. And I will say that some of these examples are, 3-4 paragraphs long, but it doesn't need to be that. We just really need to hit home the main points of why you're making the comment. We don't have to submit pages of data. We really just need to continue to hit those high points. There's some sample letters from communities in here as well, talking about, that decreased access to care. Care backlogs is another one, especially for our hospitals. We already have backlogs of people that need long-term care, skilled nursing care, and we need to encourage our hospitals to also be making these comments. The workforce shortage. A lot of folks are talking about temporary staffing and how temporary staffing is costing them a lot of money, but that could be a third or half of their current workforce. And what we really need to work on is getting enough workers just to fill those needs. And then we can move on to looking at ways to improve even beyond that. Looking at the loss of care and jobs, that because nursing homes may not be able to pay what other types of facilities or programs that use nursing staff are able to pay, they're recruiting them away from us. So we need to be able to pay our staff a living wage, and a wage that shows their worth. They're absolutely worth it, and we need to have the funds in order to be able to do that. So we've got, again, some sample letters from community, letting them know who they are, how they're associated, and what they are able to do, and why they find this rule concerning. So any questions on sample letters or any other information that other groups that you might want to talk to?
Kirsten, this is English.
Hi, English.
Hi. I was just thinking maybe about, I don't know if we need data. You said we don't right now, but there's a lot of the schools, LPN and RN, that don't even know that this is happening. I'm just wondering if they could give some, cost comparisons, like how much does it cost if we need to get into data? I'm just throwing it out there for how much does it cost for an LPN to go get their RN and those kinds of things. But just some food for thought if we have to get a little more data driven.
Yeah, that is a great group to talk to, and talking to them about even making comments with that information, I think would be really good. There are some, unfortunately, there are some groups that are in favor of this rule moving forward. A lot of those include the associations that support nurses, CNAs, those kinds of things, because they're looking at it from a perspective of, we want to make sure that we have good ratios and that we're protecting the licensed staff, which I can completely understand. There are also consumer advocacy groups that are actively supporting this. So organizations like AARP, I met with them the other day, and there are definitely things that we agree on, but there's other points in which we're going to agree to disagree. because they're looking at it from a different perspective, just like the Association for CNAs and nurses and those kinds of things are. But I do think the schools are a really great area. Nebraska has some great data out there, which I can provide to everybody as well on nursing staff and where they're working. So what we find is that there's a very small amount of RNs that are actually working in nursing facilities. And there's a very large amount of LPNs that are actually working in nursing facilities. I think the RN amount is like less than 10% for Nebraska. And so we're not able to get that group in as well. And usually it comes down to wages, work hours, schedules, lots of different things that are impacting that. But we do have the bulk of the LPNs in Nebraska that are working in nursing facilities. Now that might change. I know that they were kind of moved out of their roles in hospitals, but more recently, again, because they need the workforce, they're finding ways to bring them back in. And so we really need to make sure that we're protecting that group so that we can hang on to them long term. Any other questions on sample letters, groups that you want to reach out to? All right, well, as promised, here are some resources for you. I've listed out several of them that are all hyperlinked here. But if you just, again, scan the barcode there, you will be able to get to what we refer to at Leading Age as our serial page, because it has everything related to this rule all in one place. So you'll be able to get to the recording. Leading Age did a similar meeting to this with all of the comment information for available groups. Also those email letter templates, talking points. You can link to the actual proposed rule. You can link to the fact sheets on it. Just a variety of different materials that you can access there. But if you just scan the QR code, it'll get you right to that. So we'll leave that up for a minute. Any other questions, thoughts, concerns, other things that you want to talk about? Not seeing anything in the chat. Okay. Well, if you do need anything, we are here for you at the state level, at the national level. I just want to make sure that everyone feels like they have the information that they need in order to make their comments and make sure that they're able to spread the word about what this proposed rule could mean and how it's going to impact us in the future. The more comments, the better. For those of you that are attending Leading Age Nationals conference, make sure you get your comments in early. You will be gone on November 6th. So we want to make sure that we're getting that in as soon as possible. Also, I will add that if you're able to use the word Nebraska at some point in your comment, we are able to then search that. That's kind of the word that we're pulling up is the word Nebraska, so that we can kind of see how many comments we have going in. I know that the Healthcare Association has a goal set for Nebraska of 1,000 comments. I'd love to see that being blown out of the water. So we aren't keeping track specifically on our end, but I definitely go in and look at those comments a couple times a week just to see where we're at. So Wonderful. Well, thank you all for joining. I appreciate it. Please let us know if you need any other assistance. Have a great rest of your week.